Welcome to this edition of the Beyond the Blade podcast. We're joined by Ali and Jasmine, which are two of my nurses at our surgical practice. And we're going to have just a very informal session for this podcast. We're going to talk about a lot of the questions that our patients are sending us via social media. And hopefully as a team, we're going to be able to answer that together. So first question. Hi, doctor. Would you perform a BBL on a healthy 55-year-old female? So what would you think is the answer to that?
Yes.
Yes. Yeah, absolutely. 55 is still young, okay? Like
Definitely.
you don't have to slow down at 55. You don't have to be scared. You don't have to be worried that you're going to have some sort of problem. Just remember that we're going to put you through a very rigorous process where we're going to make sure that you're healthy before the surgery. We don't take anybody's word. I don't want anybody to be offended, but we need a primary care doctor, an actual physician who knows you, who has hopefully seen you in the last few years, that can give us a good assessment on your health and let us know if you have any medical problems, any medications, anything that we need to know about. And also, we're going to be doing a lot of tests. After 50 years old, everybody is mandated to get a cardiology evaluation. So you have to go see a cardiologist. They also have to clear you besides your primary care doctor. So you're going to be super tested, and there's not going to be a single question or concern that you're ready for surgery. So 55 is nothing, and we hope that you continue to enjoy your look, how you look and how you feel, and your confidence way beyond 55. And you want to add anything to that?
I think age is not really the factor, but you have to be a candidate for a BBL.
Yes.
So you could be healthy, but if you are not a candidate, you are not a candidate.
So please be a candidate first.
And we'll help you. We'll find out if you are, and you can send us photos, and we'll go through that together. Okay, how to choose the best size of breast implants for our body type? That's a great question, and I think this dives into one of the most complex decisions that plastic surgeons make with their patients is breast implant size. It's one of the hardest things to do because a lot of our patients have a specific aesthetic, a way that they want to look, and maybe they've seen that in a magazine or maybe they saw it on social media, and a lot of times they want to look like a particular person, or they want to have a particular volume that somebody else has, or maybe they just want to have an enhancement for themselves. So for selection, I really recommend, as in most procedures, bring 3 photos that you really like that hopefully kind of look like you in regards to the before photos. And again, these have to be photos without bikinis, without bras, basically standardized plastic surgery pictures that you can find on tons of websites online, including my website. And you can select 3 pictures that you really like and then 3 pictures that you really don't like, okay? That kind of illustrate what you definitely do not want to have happen to you. And then using those pictures, we're going to start to create a concept of size for you. Now, this can be very complicated because every woman has different sized breasts. Even the same woman can have 2 different sized breasts, and also breast positioning. So one areola is higher, one areola is lower, one breast is smaller, one breast is larger. So it becomes very challenging sometimes. And you have to be really open-minded that if you have a lot of asymmetry, then you may need more than 1 surgery. You may need 2 surgeries to try to get this to be as perfect as possible. And there's nothing wrong with that. That is just us trying to help you to achieve your maximum goal. So we also take a lot of measurements when it comes to breast implants and how do we size them. There is a chart. The chart is a rough estimate that can help us figure out what your best size would be based on what you measure. But please remember, it requires a very in-depth conversation and consultation and measurements and all of those things. Now, there was a fad, or there was a popularity. There was popularity with a 3D imaging device that had been around for a very long time, and a lot of surgeons would use this about 10 or 15 years ago, and it became a little bit of a problem because the 3D image that the computer program would produce was never really exactly what the patient would end up looking like, even when selecting the implants using that technology. So this is just a very good example about how technology is not going to replace implant selection. That really requires a human-to-human interaction and a very in-depth discussion to pick the right size. Okay, you want to chime in on that?
350 cc's on you versus your friend, it's not the same. So don't go in with a preset number that you force Dr. Z to. It may work for you. Just be flexible.
Yeah, be flexible. And very interestingly, during an operation, I may have to use 2 different implant sizes on the same person because they have so much asymmetry in their breasts. So, you know, a lot of our patients sometimes wake up and their first question is, what size did you put in? And they sometimes are shocked that we have to use 2 different sizes. And again, that is all done methodically, precisely, and, you know, in the operating room to just get you the best result. Why some doctors perform 360-degree lipo with tummy tuck and muscle repair while others don't. So maybe you want to...
Blood supply. Blood supply is so important to the tummy tuck. You really have to babysit that incision, and you have to take care of it. If Dr. Z goes in there and starts lipoing your abdomen, your incision is just not going to heal. It's not going to get oxygen, no blood. It's going to be a disaster.
Yeah, exactly.
So remember, we talked in prior podcasts about the largest organ in your body is the skin, and it's what you really have to protect after a liposuction surgery. So if you're going to have a tummy tuck, we can still do liposuction, but we don't do liposuction of the anterior part, of the front part of your belly, of your abdomen, because that is where the blood supply is coming down to feed oxygen to your incision, which is at the pubic hairline pretty much below the bikini. So in the front of the abdomen, we don't touch that spot. What we do there is we do your muscle repair. We lift up all the tissue. We pull everything down to get rid of all the skin laxity. But we don't want to be doing lipo there because then the wounds won't heal. Now, we can do lipo, and we do a lot of lipo to the back, for example, to the waist and the flanks. You can do lipo to your neck to get a better neck contour and shape. You can do lipo to your arms, to your thighs. So there are a lot of options for lipo when you do a tummy tuck at the same time, but you don't want to be lipoing the whole entire abdomen at the moment of a tummy tuck.
And also maybe the lipo, like there is the consideration of visceral fat. So maybe lipo to the abdomen won't really solve the issue that you're concerned about.
Yeah, and if you don't know what visceral fat is, I would encourage you to jump on Google, look at the image section when you type visceral, which is VISCERAL, visceral fat. And that's basically going to show you a photo of all of the fat that all of us have as human beings behind our muscle. It's where our stomach lives, all of the organs live. If you have a high BMI or body mass index, you're going to have a lot more visceral fat. And that's going to cause your abdomen to look round, to look protuberant. And you know what? Liposuction in that case is not a good idea because all I'm able to suck out when I do lipo is subcutaneous fat, which is the fat below the skin. But I cannot touch your visceral fat because that would be a big complication. It would be penetration of the abdomen. And so we'd never want to do that. So visceral fat is weight loss, maybe some semaglutide, maybe some phentermine, maybe a diet plan, a nutritionist, a trainer in the gym to burn down that BMI and get you the best result with liposuction. And everything is about being a candidate. Okay, what are some recommendations for home when doing a lower body lift? Jasmine.
Some recommendations for home, probably pain control will be one of them. So make sure you're taking your pain medications as needed. Hopefully you did the pain package, so hopefully you're doing okay. Otherwise, we do provide you with an oxycodone prescription, so you can take it as needed, definitely as needed. Have a stool softener available in case you become constipated, or just simply take Tylenol extra strength. The lower body lift can also be a little bit messy because we're looking at 4 drains. We're looking at 2 JP drains, which we'll teach you about, and 2 Penrose drains, which are flexible little tubes in the back. So when it comes to laying down, you may drain a little bit more than other procedures, and that's okay. We prepare you with the proper supplies that you should get beforehand. So drainage is one of them, pain is one of them, and then wear your garments after the procedure as we indicate you to. Those are the main important things, and make sure you're ambulating. Super important.
Okay, fantastic. Ali, help us with this one. I want to know more about the tissue glue that you offer.
Ooh, that tissue glue. Artis is a very, very good option if you are planning on doing a tummy tuck, lower body lift, breast lift, face lift, anything that Dr. Z has to manually lift tissue from the muscle. Artiste is a great option. It decreases your chance of getting a seroma. It also is a hemostatic agent, so it decreases your chance of getting a hematoma, which is essentially like blood under the skin. And it is also really good just for skin tightening in general. It gives you a better appearance, and it's silly to think, but Dr. Z actually goes in there, sprays you down, and holds that down like a paper glue thing.
Yeah, that's exactly what we do.
And it works.
Yeah, it works. And so we spray it in the tissue and we literally hold it down into position and we wait 90 seconds and we let everything kind of stick back together again. And everything that Ali said is exactly right.
Yeah, patients ask us if we can use Pravina when you're doing Artiste or if you can still do those add-ons. And the answer is yes.
Yes, the answer is yes. All right, so we're going to be able to get to one last question here. And let's see. Jasmine, after a capsulectomy, can you put a new implant or do you have to wait a few months?
After a capsulectomy, you can get new implants in, but you should be aware that your chance of getting a capsule again is not unheard of. So you are definitely at a risk for getting one, and you can do it after a few months. It's definitely a decision that you'll want to think about just because, you know, if you're going to get one again, is it, you know, it's something worth considering. But yeah, definitely wait a few months.
Yeah, the topic of capsulectomy is very important, and we can elaborate that on another session. But basically, once you've developed a capsule, you are at a higher risk of developing another capsule, even if I do a complete capsulectomy and I put in brand new implants. And we still don't know why capsules happen in breast implant surgery. We're not exactly sure. Actually, the incidence has gone down over time because we have learned that using specific antibiotics to wash the implants and to wash the pocket of the breast has brought down the capsular contracture rate. But it's still about 10 to 12% are going to get a capsule, and you may not want to put implants in again if you've already had a capsular reaction. So anyways, that's something for another discussion, but we want to thank Ali and Jazz for joining us on this edition of the Beyond the Blade podcast, and we hope to see you on the next one. Thank you.